Hi, everyone. Welcome to this episode of the Hit Like a Girl podcast. I am Kathryn Ayers Wickenhauser, Director of Communications at Direct Trust, and I am so pleased today to be with Lisa Bari from Civitas. And I want to follow in the footsteps of my friend Kat McDavitt, who in her guest episode, she's told a little story or how she met the person originally. And this wasn't actually when I met you at first, Lisa, but I remember following you on Twitter and always just being so excited by your insights and the things that you would share. And I distinctly remember the last ONC tech forum or annual meeting, the last one that we had kind of before the pandemic shut everything down. And you went and sat down in the front row, and I nudged Scott Stewie, our president and CEO, and I said, "That's Lisa Bari." And so I remember that that's kind of the first time that we interacted, that I met you and saw you, and I've been so pleased to get to know you over the months and the years since. And I'm really excited for you to be here today. So, could you tell us a little bit about your background, about Civitas, and then maybe also your why? What drives you to be excited and to work in health IT?
Yeah, sure. Thanks, Kathryn. It's great to be here. So Civitas Networks for Health, we're not, it's not an acronym, just Civitas Networks for Health. You can abbreviate it by saying Civitas, like you did, is a new organization that was created out of the affiliation between the Strategic Health Information Exchange Collaborative, where I'm currently the interim CEO, and the Network for Regional Healthcare Improvement, which, and then those two organizations together will make up Civitas Networks for Health starting on October 1st. And I'll serve immediately as the interim CEO. And so we are together a national membership organization. We're both a membership and a mission-driven organization that represents pretty much all of the community, regional, and statewide health information exchanges and the regional health improvement collaboratives across the country, covering nearly the entire country. And we also, of course, have a Direct Trust as one of our member organizations in our affiliate member category of organizations to support our HIE and RIC members. So happy to continue to work with you and Scott and the team. So that's all great. And so, myself, I have a background in health IT. Before that, I worked, broadly at technology companies, software as a service companies, media companies in the Bay Area. And after working in health IT at the now infamous EHR company, Practice Fusion, where I led marketing and communications activities for the organization, I found myself really interested in health IT issues, but really, really burnt out by the startup world. Ended up sort of focusing on policy issues and decided to go back to school to get an MPH. I was one of the older Master of Public Health policy students at the school, and thought I was going to go back into startups, and decided after just even a little bit of exposure to health policy at the academic level that I had to get more information about how health policy was made in America. And so I decided to go work for CMS. I worked for the Centers for Medicare and Medicaid Services Innovation Center on key value-based care, primary care issues. I wrote health IT and interoperability policy for CMS and also for the various programs. And then eventually found myself wanting to leave and do other stuff. And then that's how I ended up being the interim CEO of Chic for the last year, and then now moving into Civitas. That's just a very sort of brief overview, but I think that, to get to your question, which was, why do you care about this? I think that for me, I grew up in a family that was full of activists. My mother was an environmental activist, and I spent my entire childhood sort of doing organizing work, going to rallies, sort of being very exposed to that world. And both of, my parents and my family before that really, had this sort of focus on taking action, on doing something you really care about, sometimes even sacrificing huge parts of your life for that. And I really saw people living with that kind of intention. So that's very much my personal orientation. I'm somebody who, if I see something that's wrong, I want to make it right. I'm very justice oriented. And, I have a sort of a personal, comfort level with just technology and that space. And that's where I was working before, but I really didn't have any kind of a why to that, right? Working for technology and media companies, I found it to be interesting, but it didn't really, answer sort of that need that is within me from how I grew up to work on something I really care about. And with healthcare, unsurprisingly, like probably many people who listen to this, come on this podcast, et cetera, healthcare is for me a thing that I care deeply about. And I care about it for lots of reasons. I believe that healthcare and health is a human right. And I believe that everyone should have access to high quality care. And so that's just a very kind of baseline orientation for me. And then why health IT specifically, it is something that I understand and something that I am now good at, right? And so it's an area of healthcare that needs more people to be involved, needs more people to understand how it works and what animates it, what makes it move forward or not. And so, bringing those two things together, that's why I'm specifically in health IT in a very sort of broad sense of the word. What I will say as well is that I also now believe, after this many years of working in the space, that health IT and health data is critically important for us to focus on when we think about health equity issues. The access to health data, the digital silos, digital divide, or some people call it digital redlining, is really, really, really critical for broadly reducing health disparities across the country and increasing our focus on health equity. So my interest and my motivation has really changed and grown over the years. And now I'm in this camp where I just think like this is a really critical area of focus for looking at health equity issues.
Sure. And I appreciate so much you sharing your background and your why. And I can relate a little bit, but in a slightly different capacity. So I come from a family of volunteers. So, you have kind of your day job and what you do, but you also volunteer for the organizations that you're passionate about and the things you care about. And that's one of the things that really drew me to Direct Trust. Is Direct Trust is a membership organization. And we have many people who do their work, but also volunteer. And Civitas is the same way. You have your member organizations, and these groups are doing wonderful things within their community and within the industry, but also volunteering to move together as a group and kind of having this collective wisdom and information sharing. And so I'm curious, maybe if you could tell the audience a little bit more about Civitas and how Civitas brings people together and what the role is of Civitas in the healthcare industry.
Yeah, so as I said, Civitas is the combination of CHIC and ENRI, the Network for Regional Healthcare Improvement. And what we saw over time was that HIEs, the community, regional, and statewide HIE organizations, were really doing a tremendous amount of work in the health improvement space. So in the beginning, 15-ish years ago, HIEs were just built to facilitate clinical data exchange. And then, of course, over time, as the federal government got involved in different ways, as healthcare technology broadly developed, those organizations started doing more and more work within their communities and in response to the needs of their participants being like providers, hospitals, doctors, et cetera. And so because of that, you now have these organizations that do a wide variety of work, which is really spans, multiple things, whether it's clinical data exchange for different purposes, whether it's public health work, whether it's quality improvement and quality measurement work. Really, there's a whole variety of things that they're doing. And so we saw that develop. And then we also have these organizations called regional health improvement collaboratives, which are also, just like the HIEs we represent, multi-stakeholder governance model organizations. That means that basically, there are people on their governing boards, they're nonprofit organizations, who represent their stakeholder organizations, whether they're providers or payers or patients or purchasers or employers, local government, et cetera. So these organizations are very similar, and they're starting to do more and more similar work. And it just made sense, given all the cross-pollination between the two groups, that we would bring them together. So this process has been like, almost a year now. We're coming up on a year of bringing the organizations together. And what we're doing is creating this new organization, Civitas Networks for Health. And we say we're dedicated to transforming the healthcare system to improve affordability, quality, and health equity for people locally and nationally. As I said, we represent HIEs and RICs, and really animated by the COVID-19 pandemic, obviously, really emphasizing how healthcare and approaches to improving health are local, right? We really believe that there's all of this important local knowledge, local convening, that's the community, the regional, and the statewide level, and that you might have sort of national networks and frameworks, but they really only exist over time based on the success of those local, community, regional, and statewide approaches to HIE and data-driven health improvement. So those are some of the important things we care about. We say our tagline is regional innovation, national impact. Our website is Civitas for Health, FOR health.org. And so we're, a nonprofit membership and mission-driven organization. So we're still really rolling out Civitas to the world. And what that means is that we are working with our members and the work that was already happening with Geek and Enri to really say, what are the things we want to tackle together? And, one of the kind of preview areas that we'll definitely be tackling more is the sort of future of social determinants of health data and interoperability. So we expect to have, a lot of activity in that area in particular. But we'll keep serving our members, as we did in Geek, as we did in Enri. We have committees and work groups and sort of ways to collaborate, kind of what you were saying, Kathryn, about volunteer. We very much depend on our members volunteering, right, their subject matter expertise, their time, their engagement, but we are really trying to help them at the national level with this national collaborative.
And I love that tagline. I have more questions about Civitas, but before we get there, you mentioned that Chic and Civitas, it's a nonprofit, and you highlighted at the very beginning some of your background, but I'm wondering if we can dig in a little bit more, because I'm always curious about how people get to their current role. And I know, personally, I've had kind of a weird trajectory to get to where I am. I went from EHR training to compliance to communications. And it's so interesting just to hear how different people got to where they are. And I think in health IT in particular, we kind of see that multifaceted and that people are in different sectors and different arenas before they finally get to the role that they're in now. So could you describe a little bit about how you got to your current role at Civitas?
Yeah, absolutely. So, as you kind of mentioned here, I've worked across for-profit companies, I've worked in the government, and I'm working now in the nonprofit sector, and so the non-governmental organization sector. So I'm from the Bay Area, from further north, but if you're from Northern California, you say you're from the Bay Area, that's what you do. And I lived, most of my younger life in the Bay Area. And so when I graduated from college, it was sort of it was in the dot-com boom and bust era. And everybody who was graduating at that time was, going into work for like startups. For startups, they were kind of like called Web 2.0 startups at the time. And I did the same thing. And then very quickly, the economy collapsed. But I, had some initial sort of startup experience then. So those are, venture funded, primarily technology focused organizations. And so that was a lot of my career then. And then, and that really took me kind of all the way through to when I worked at Practice Fusion, when I was the marketing and growth executive there. And it's a really, it's just a really, volatile life. I think in any case, I think something like maybe a single digit percentage of startups actually are successful. And that's absolutely true in the space. So I was feeling a little bit burnt out from that, and also from the fundraising cycle. When you are a venture funded company, you go through different funding rounds. And I think we were up to Series D, and I had been part of that process. And little did I know that experience of fundraising would be very helpful in the nonprofit space, but I did have some experience there. So I was like, all right, I need a break. So then I went back to school and then moved to the government, which is of course a very, very different environment in terms of, what it's like to work in the government. I think many people probably know that the rules are different, what you can say is different, how you can present yourself to the public is different. Those things are all true. I would say I definitely pushed the limits on that. I think that people are very nervous, for example, to have a presence on Twitter if they're a government employee. And certainly I said less than I say now when I was a government employee, but I still, found I walked a line that was apparently an appropriate line because I never got in trouble for it when I was a government employee. And then really just, I've been a consultant for some time. That's obviously like working in a for-profit company for yourself, very different, no boss. You are your own boss, and you have clients. And then just really ended up falling into this nonprofit space because of the need to the ask from the HIE community to support them by taking on the interim CEO role. And I think one of the cool things about Civitas Networks for Health is that we are a membership organization, but we are a 501c3 nonprofit, which means we have a charitable purpose for the work that we do around health information exchange and health improvement. So we hope that we'll be able to, bring that to bear to the work that we do and really emphasize the mission that we are putting forward.
I love that. And I thank you for sharing your background too. And it's so intriguing always when you hear the different skills that people pull from different roles and life experience. And I think that's true in healthcare, pulling skills from outside of healthcare into healthcare. And like you highlighted, that fundraising experience, that becomes a transferable skill.
Totally.
Anything else that immediately comes to mind kind of as a transferable skill that you now pull from in your current role with Civitas?
Oh, absolutely. So one of the things, I definitely consider myself to be a policy person, a health policy person, but I will say policy and politics more broadly, which if you are the CEO of an association, you're essentially a politician, whether you like it or not. The skills that I pull on most are absolutely marketing and communication skills. I worked as essentially a marketer in various capacities for over a decade. And I think that experience is probably the most valuable experience. Communications, comfort with, communicating in different audiences, understanding in which messages will really land with people. That's just so critical. I use it every day, and it was absolutely really, really important in my facility with policy and policy work.
Mm-hmm. And just thinking back to your comment about Twitter earlier, to me, something is communications is a skill, right? It takes practice, It takes time. That comfort level takes time, and I think about you and your role previously at CMS and being a government employee and walking that line, as you said, on Twitter, but also to me as someone who at that point was in the for-profit world, it was very helpful to me to see people within government kind of share their thoughts in the way that they could and information in the way that they could. And so I'm sure, that's definitely helped. Now I see your presence on Twitter and I'm always so excited to hear your thoughts now. And as you said, whether you like it or not, when you lead a nonprofit organization, you're a politician and you have a podium. So thank you for sharing all of your background and for using your podium and promoting some of the things that many of us really care about and seeing how we can make a difference. And so in that vein, maybe you'd consider this a win from working at CMS and being able to walk that line with Twitter. But I also don't think that we celebrate our successes enough. And so I'm interested if you might share if there have been any moments in your career that you've been especially proud of, or any wins that just really make you feel good that you'd like to share with the audience.
Yeah, I mean, I definitely think that, I'm hopefully poised, and the team that I work with is hopefully poised for a big win when we launch Civitas Networks for Health successfully. It's been a year almost now, like I said, and um, you know, it's just a massive effort. Even though these are tiny, relatively speaking, tiny nonprofit organizations, it is a lot of work to bring together two organizations. It is a lot of work. And so, getting through the various stages of that has so far felt like a win to me. And of course, I really could not have done that alone. I think, for me as well, my work at CMS was really, really rewarding. And I think that it's very, I want to say it's almost addicting, this feeling when you are in a really, I would say, important position in government work, because the impact that you have with government work, especially if you're working at CMS, Centers for Medicare and Medicaid Services, massive, massive payer for basically a huge amount of healthcare in this country. You can't match the impact that you can have there. It's really frustrating. There's tons of downsides to working in government, but it'll be like almost every day you're doing something that has a huge, huge, huge impact if you're in the right role. And so I was helping create, launch and run the Comprehensive Primary Care Plus model, which is a big value-based care model for primary care across the country, many different sites, many different states and regions, and just a huge impact on providers, on doctors and practices, and on patients. And so you just everything that we did was really important, actually, for those providers and practices and patients. So writing a health IT policy for that model and getting something out there, convening a group of payers who are working together on that model, seeing the first evaluation reports, being a co-author on the CMS interoperability and patient access proposed rule, that has a huge impact. Being able to brief, the Secretary of HHS and work with all kinds of different organizations, those things all felt really, really big to me. And so those were all some wins just from that experience. Similarly, when I started my now fairly brief consulting career, because I got a job, I don't know that it was an intentional job, but then I found out that I was leading this effort with Geek and now with Civitas. It was always really wonderful to, get a new client and work on something new. So
That's wonderful. And like I said, I really feel like we don't celebrate enough, or things happen and then we kind of move on to the next thing. That's the way that life goes sometimes. And so I really like to celebrate those wins and successes. And kind of on the flip side, because you have so much varied perspective, I'm also interested in what you think opportunities for improvement or challenges that you see in health IT are, and then maybe even kind of a slightly different spin on that. Any challenges or opportunities for improvement where women might be best served to lead or could really make a difference in advancing something or addressing an opportunity or challenge.
yeah, I mean, I think that I would say, I maybe turn it a little bit on its head and say that I think that there's opportunities for leaders, women and not women, anyone else really, who maybe don't have a super deep amount of experience in the field. But what's really important, of course, is that you educate yourself, and that you get experience, and that you really dig in. It's easy to skim on the surface, and it doesn't mean that you have to be, you don't have to be a programmer, obviously, right? There are tons and tons of other important jobs across all aspects of health IT. But what's really important is that you take the time to learn and understand. Most people in health IT are not informatics specialists or programmers. And that includes men, are also not all programmers or informatics specialists. what really will distinguish someone if they take the time to really understand how do the pieces go together. And if you ask someone to explain that in depth and you ask really good questions, you can start to understand systems and how they work together and what they do. And it really just takes taking some time and asking questions and reading and researching and being curious. I think people often just stop and say, it sounds too complicated, so I'm not going to go further. Or I'm just a marketing person. What do I know about X, Y, and Z thing? And I think you can be most effective when you really push beyond sort of surface level questions. And like I said, most people actually don't do the sort of building blocks work. Most people do work that connects different pieces together. And in particular, communicators are really good at understanding how things go together and then explaining that to somebody else. The key to learning and educating yourself is being able to explain it to someone else, right? You know you really get it when you can truly explain the pieces and how they go together to someone else. So I think I would like to see more people, really dig in and understand the work and be able to talk about it at a deeper level. And so I think there's a tremendous, just because of the sheer numbers, there are tremendous opportunities for women to get involved across many different aspects of health IT, interoperability, health data work, because there just aren't very many women in the field, as you know. And so anybody should get involved and should think about how they can educate themselves and learn, how to put the pieces together.
I think that's great advice. And I want to focus a little bit more on something that we talked about earlier with support and equity and inclusion, and knowing that that's important to the listeners of this podcast. I want to start with Civitas first. And you mentioned a little bit about what role Civitas might play, but maybe could you describe a little bit more about how Civitas might fit in to driving health equity and inclusion?
Yeah, absolutely. I mean, we're still, as I mentioned, building out all of our programs. We have a couple of different areas. One is very internal facing, and that is that, as you know, we have a ton of different members, and the people who are most likely to be involved in Civitas's work, I mean, Geek and Henry's work, are really the senior leaders of those organizations, and that's not great, actually. We really need people from all levels of our member organizations to be involved. And we need to also encourage our member organizations to, do work to build up their own teams, to ensure that those teams are diverse, to ensure that there is sufficient inclusion and equity across what they do. So one of the areas that we plan to bring with us into Civitas from Henry is called the Emerging Leaders Council. And the Emerging Leaders Council really tries to bring in folks who are not at that top tier in our member organizations into our work in a meaningful way, and have them also advise the board of Civitas. So that's one area that's going to be kind of more inward looking. How can we really help our organizations build a more diverse bench, right? To really and really promote those people. I think for me personally, this is more on a personal level. I really, really believe in succession planning, even though I'm really just starting in this role as the interim CEO of Civitas. It's going to be really important for me very quickly to make sure that we're doing that work internally in our own little tiny nonprofit organization, and really deepen our focus there. Also, and we are all sitting here waiting right now at this moment in time at the end of September, the ONC was supposed to release supposed to award the public health informatics training monies that they put out a bid for, I want to say a couple months ago, which were intended to be a significant amount of money for various minority serving institutions, whether they're HBCUs or other minority serving institutions, to actually do really important workforce training in public health informatics. And Civitas, as Geek, supported a couple of those bids. And we are eagerly awaiting the results, because that will be really, really huge for us in terms of also supporting a pipeline of diverse professionals in the space. And so if that happens and any of the awards are given out, I think we'd love to be involved in supporting those folks and those programs with internships and training and I don't know, we haven't done this yet, but let's say free individual memberships, just anything we can do to bring people to our conference. We really have the intention of doing that. And with our conference, I would also say we announced at our conference a couple of weeks ago the Keith Hepp Memorial Award, the scholarship fund, to bring different folks from our member organizations and also from community organizations to our conference. Keith Hepp was the previous chairman of the board of Chic, who passed away, unfortunately, last year, very tragically. And in his honor, a scholarship fund has been created to bring more folks to our conference, also from the community, and really just try to broaden our view a little bit. So we're excited about that as well. And then one more thing, this is personal, this is not Civitas related. I have been also involved at some level, at a small level, with Morgan State, which is the HBCU in Baltimore where I live. And I am in the process of creating an endowed scholarship fund called the Health Data Equity Endowed Scholarship Fund, which will hopefully support students who are able to attend Morgan State and study in their new informatics training program, which is being created now. It's not in operation yet. So working with them and trying to support them as well. And for me, it's just really a matter of we need a pipeline of qualified people. We need to look at places that have been underrepresented, and there's a lot of people who are not represented in our workforce. And so what can we do to change that in a dramatic way over the next couple of years?
Sure. And I think for the people who are listening, I think there's an actionable item. There's a takeaway here where Civitas and Chic kind of set a precedent for that Emerging Leaders Council is incredible. And just how all these pieces fit together that you just talked about, and that pipeline, that succession planning. How can we in health IT really take that to our own organizations? Because think about how much further that will get all of us. I say it over and over again. I overuse this phrase, but collective wisdom, I really believe in knowledge transfer and like you said, training kind of the next generation or other people on your team and bringing them up. And so I think that's so critical. So thank you to Civitas for leading the way and doing these things. And thank you to you for that endowed scholarship. I think that provides a wonderful example of what someone can do that's actionable and really to create that pipeline and hopefully drive a more equitable future.
Yeah, I mean, I think I started to feel really strange about it. I have to tell you. I mean, I think that some of your questions are definitely right on about the underrepresentation of women in our field. But even more than the underrepresentation of women is the overrepresentation of white people. You and I are both white women. The people I work with are primarily white women, and of course, white men. And it's a reality. We have to look around us and say, this is not what the rest of America looks like. And that is a huge, huge problem. I think that doing good work is critically important, but I think we also have to address the uncomfortable truth that it is a very white dominated industry. And it's just not going to get us. It's not going to get us where we have to go. It's just not. And so I'm hardly a hero. I'm certainly not personally stepping aside right now. I would love to get to a place where we can really make a difference in the work that we're doing and really diversify our teams, our organizations, and our conferences and everything involved. And so I'll do whatever I can to move us in that direction.
Thank you for highlighting that specifically. And, thinking about the many women who listen to this podcast and their varied backgrounds, everyone lives, works, plays somewhere differently. It comes from different cultures, different backgrounds, different life experiences. I think the women who listen to this podcast are very supportive of each other. And I'm interested too in anything that you would say or words of wisdom or advice that you would give to continue to foster that cooperation and collaboration rather than competition.
It's a really interesting point, Kathryn, because I think that one of the things that I've really tried to focus on with Chic and now Civitas over the last year is this idea of cooperation and collaboration in the HIE world. Not to get too in the weeds, we have a tremendous amount of change happening in the industry. There's consolidation, there's a co-opetition, there's mergers happening, acquisitions. It's a really dynamic space. And sometimes, the various leaders in the space and the organizations can get really competitive with each other, rightfully. They are in many cases in competition. They are going for the same things. They're trying to acquire the same, resources, et cetera. And so I have really, really, really tried to emphasize, collaboration, co-opetition, let's work together on the things that we agree on and leave the other things behind. There is a real benefit to us collaborating, even if we're also in competition. And I suspect that is potentially more of a woman-led approach. I don't personally, I don't think about that a lot, but I think it is something that you see across women leaders. It's this idea of like, let's find a way to cooperate. Let's find a way to work together. Let's find a way to benefit from the things we can benefit from together. And so if that's the case, and I would love to claim that, of course, and say like, let's do that. I do think that, there is just a fundamental sort of, because there are so few women in the space still, we probably feel an unconscious or subconscious need to band together and to work together and to help each other out. I think most people feel that way. And so I think that, I suspect that if we bring more women into the health IT space, that we will see more cooperation, I hope. And so that's what I'm anchoring on. I'm going to claim that and say, hopefully that's what will happen.
Sure. Yeah. And to me too, in that regard, and being welcoming and bringing more women in, just looking at balance and thinking about how there's always change in health IT. You mentioned mergers and acquisitions, and there's always new regulation out, right? There's always more that we can do. And just thinking about the specifics of the past 2 years and the pandemic and how many women have left the workforce and many women have unfortunately left health IT. I think pulling from your different experiences with the government, from the for-profit sector and now nonprofit, how can we bring women back into the fold? How can we engage them and get to that point that you were just anchoring on of being more collaborative and using the skills and the talents that everyone brings to the table? How can we engage and create space for women again?
Yeah, I mean, I think that, first of all, I think that flexible workplaces are critically important for everyone, for men, women, every single person. I think we've seen that with the pandemic. I think that flexible workplaces are probably more important for women who have children and are balancing a variety of different responsibilities, which are probably all full-time responsibilities. Let's just be honest. I think that for me, during the pandemic, it was absolutely critical that I could work from wherever I was. And I imagine that is the same for a lot of people who are dealing with many responsibilities at home and at work. So my hope is that we'll be able to continue that. Civitas, to be clear, is a fully remote workplace, so that is no problem with us. And all the folks in our team and their families are able to be as flexible as they need to in terms of when and where they work. So that broadly is really important. I absolutely do not believe in the butts in seats, management style. And I personally just really, really appreciate the flexibility of working when and where I need to. And I think folks do as well. So that will help to some extent. I think the other thing that will help is this idea that, you can work maybe not full time sometimes if it's relevant for sort of your life and your work. And the idea that people who don't work full time are not able to sort of contribute to a company, are not able to, move up in the ranks and be promoted, that's going to be a real problem. Other countries do things like job sharing when people need to, and it's not a problem. And they are able to continue to contribute and move forward in their careers. So we have this culture of work that isn't flexible enough for most people who have full-time parenting roles as well. So I think that those things together will hopefully help with this. But I think that there are also bigger problems at the sort of countrywide societal level about these bigger trends you just mentioned, like women leaving the workforce and women leaving health IT in particular, that I'm not sure that we can solve overall. I think it's a bigger change. So from my little vantage point, I'm trying to create a workplace that is flexible and that allows people to contribute and be recognized with a flexible working environment and a remote first working environment. But it's a bigger, more complex problem than Civitas can solve, but we will certainly try and do our part.
Sure. And leading by example is so huge, right? So walking the walk and Direct Trust is a very similar organization to you. Also, we're very similarly oriented, and that's been huge. And maybe looking at kind of the larger trend of how work has evolved in the U.S. too, and even our understanding of workplace and the traditional, quote unquote, traditional person in the family who might be working. I crowdsourced questions from before we got on the phone today, and one of our mutual friends, Cora, she wanted to know in that vein, do you have any advice or anything that you've encountered along the way for making a name for yourself in a male-dominated industry?
Yeah, I think for me, I grew up in an incredibly egalitarian environment. I was very much surrounded at all times by women leaders. So for me, it was like a very obvious thing that women could be in positions of leadership and that women could have credibility in a technical domain. My mother was a carpenter, a skilled carpenter. She was the foreman of her crew. Essentially, she built yurts, eight-sided homes. They're very complicated to build. So I always had so many, so many examples of women who were leaders in various spaces. My grandmother went back to school when she was in her 40s and got her PhD in math and graduated when she was 47 and went on to become a professor. So, just so many examples. So for me, I would say, it would never occurred to me, not even really once, that there was anything that I couldn't do. And I've always been very comfortable working with men and women. And I didn't have any choice, right? Because when working in technology companies, even if you're working in marketing and communications, you are for sure surrounded by men. And it's the same today. So for me, it's just a matter of, just being comfortable with my own skills and experience and just being confident. Like I said, I like to understand things fully and I like to ask questions. And I think I'm very curious about how things work. And that really helps me build credibility with everyone. I hope. and I think that's especially important. It is really important to approach conversations with your colleagues, especially if they're men, with confidence. And it needs to be confidence that's grounded in reality. You have to have credibility. You have to know what you're talking about to some extent. And you may have to know what you're talking about more than a man does, as you probably know. But that's okay, because again, I'm curious about how things work. I want to know how to explain it to someone else. And when I go in with that perspective, it seems to go pretty well.
Sure. And there have just been so many great takeaways from this conversation. So thank you for jumping on the phone with me and for just telling us a little bit more about yourself and your background in Civitas. And so I'm curious, maybe just to wind up our conversation today, any final thoughts, advice, words of wisdom, anything at all?
Yeah, I mean, I guess I would just say that I really, I think it's, I want to go back again to what I said before. I think that women who are in the health IT field, broadly spoken, whatever health IT means to us, all kinds of different jobs and companies, I think we both have the obligation to try and be really inclusive about our work and bring in other people, bring them into the field, help people understand, help people when they're starting to ask us questions about how this really works. Don't leave them there with sort of a high level understanding and just sort of plugging pieces together. Help your colleagues learn, help your colleagues get information, help your colleagues, be more credible in their field. I think that's a really important obligation. And then I would also say, again, I think it's really critical that we look around and say, not only do we have a lack of women in the field, we have a lack of people of color in the field. And what can we do to, bring in more folks through various means, whether that's being willing to hire someone across industries who has relevant skills. I mean, Kathryn, you called out different types of skills that are really important in the field, and you can find people with different backgrounds who maybe just need a little bit of training, need a little bit of experience before they can really be effective. And that has to also be something we focus on. So I would say, help your colleagues, build your skills, but also make sure we bring other people into this work, make sure we bring people of color, and make sure that we bring people who are younger and maybe are just starting out in their careers. Make sure we bring in people who are older with tons of great experience, right? It's just, we really have an obligation to say, if this is something that matters to us, being a woman in health IT, then we have to also say, it matters that we have people of all different types and backgrounds, whether it's experience, whether it's a lived experience, whether it is an identity, whatever it is, we have to bring people in together. So we should be the ones who are leading that charge, I would say.
Yes, I could not agree more with you. And so, just as the final piece of today's conversation, if someone wants to follow you or connect with you or with Civitas, how would they do that?
Yeah, so I mean, the best place, as you mentioned, is that I am on Twitter quite a lot, maybe too much. My Twitter handle is at Lisa Bari. That's LISABARI. And then we also just launched our new Twitter handle for Civitas, and it's at Civitas. That's CIVITAS, the number 4 and health. Civitas for health is our Twitter handle.
Awesome. Well, Lisa, thank you so much for today. It's been a truly tremendous conversation. I'm so excited for the Hit Like a Girl community to listen to this podcast and tell us what they think, and have a great rest of your day.
Awesome. Thanks, Kathryn. Nice to be here.